One of the most toxic risk factors for your brain, heart and kidneys is high blood pressure. And while globally 1 in 3 men and women have high blood pressure, a high proportion don't have it under control. The consequences in terms of heart attacks, strokes, dementia and chronic kidney damage are enormous. According to new research, a single pill containing a quadruple combination of quarter doses of blood pressure medicines could transform blood pressure treatment. Clara Chow led the research. Clara is a cardiologist and Professor of Medicine at the University of Sydney and Academic Director of the Westmead Applied Research Centre. Welcome back to the Health Report, Clara.
Thank you, Norman. How are you?
I'm excellent. What are the challenges this quad pill tries to solve?
Yeah, look, it tries to solve the problem of blood pressure control. While, as you noted, a third or more of the population have high blood pressure, a large percentage, at least half of them, don't have it under control. And that's probably because we're not treating it well enough.
And people need their dose adjusted, they go off their medication and what have you.
Yeah, look, so the common way, when a person has hypertension, they start on one medicine, and that medicine is one type of drug, and then they, come back and they don't have good blood pressure control, so they start another medicine, and then they might come back and start another medicine. Now, that would be a good situation if they came back multiple times and the clinician looking after them kept on up-titrating. We know that the majority of people need at least 2 types of medicines to control blood pressure, but the majority of people are currently only on one type of blood pressure lowering treatment. So in other words, they never get past first base in terms of treating their blood pressure.
Now, this research builds on a long-standing body of research which you've been involved with and others called the polypill, where you cut down on side effects but also increase the effectiveness in theory by adding different medications together. And in this one you've got 4 medications, 2 broadly relax the blood vessels, one's a diuretic and one's a beta blocker in one medication. When you did the trial, what did you find?
Yeah, so this was a double-blind randomised controlled trial. So what we did was people with hypertension were randomised to either get the quad pill or monotherapy, in other words, one drug at, one dose. Patients nor their clinicians knew which one they started on, and they were allowed to add any other medicines on top of them in terms of, add additional medicines as they would in usual care. So at 12 weeks, which is what we call our primary outcome time point, people on the monotherapy, so the single drug, about 40% of them had their medicines up-titrated, and people on the quad pill, only about 15% had their medicines up-titrated. But the people that started on the quad pill arm, about 80% of them had got their blood pressure controlled, whereas that was just under 60% on the sort of common strategy arm. So it showed that initiating with the quad pill was much more effective than initiating on the monotherapy arm. The other thing we looked at is that we follow these patients to 12 months. You might expect that the monotherapy arm, that's the usual kind of arm, would catch up because they could add other medicines across time. But really interestingly, they didn't catch up. And at 12 months, we still had the same numbers, 80% control in the quad pill arm and 60% control, or just under 60% control in the monotherapy arm.
Another argument for the polypill is that you get fewer side effects because you've got lower doses of each medication in the pill. Was that true in this study?
Yeah, so we didn't get fewer side effects. We got no difference in adverse events between the two groups. Yeah, I suppose on one hand one might expect fewer side effects, but the common strategy arm, we did start with irbesartan, which is probably the lowest side effect profile medication there is. So I suppose we're comparing it against something pretty good. I think that, we probably need to look at that in more detail. And unfortunately, because of COVID, we were a little bit what we call underpowered. We weren't able to recruit all of the patients we want to get a significant difference in the side effect profile. But what we can say at this point is that there was no differences between the two arms, and there was no increase in adverse events or no differences in bad events.
Now, the bad news here is nobody's making a quad pill. These are competitor competitive pharmaceutical companies, and they're unlikely to get together to produce one. I mean, how do you actually implement this?
Yeah, so at the moment, I mean, if I've got keen patients and key people around the place that would like to implement it just right now. And I suppose one thing I can say to them is all of these medicines that we use are available in Australia. And if you were to be keen and go to a compounding pharmacy, they can, cut them up and sort of make it up for you, so to speak. Obviously, that's not an off-the-shelf approach. The other thing I can say is that, the usual way in Australia is still to start on one drug, and we can at least do dual combination or two-drug combination therapy in Australia, though it isn't at low dose, but that is kind of another alternative that we've got sort of on the market here today.
Okay. Well,
in terms of working with other companies, I mean, gosh, sometimes I think I'm a researcher, but do I need to branch out to try to work out this problem of how other companies have to come together and work this out to make this medicine? I have had a few calls about that, but I'm hoping someone else sorts it out.
We're just about out of time, but thanks, Clara. Fascinating research, and if you get the solution, we'll tell the audience. Professor Clara Chow is a cardiologist and Professor of Medicine at the University of Sydney, and is also Academic Director of the Westmead Applied Research Centre.